Hi everyone, this is Justine Allenbach with the Center for Housing and Health. Thanks for being here at our Skilled Assessor quarterly meeting. Sorry that we're a little bit late. I was having some troubles getting the webinar started and I still can't, for some reason, I normally can see a question box in these webinars, but it's just not working for me today and I can't see who's in attendance, which normally I'm able to see as well. If anyone's able to access the chat, I think there is a chat box. Would anybody be able to let me know if you're able to hear me okay? Or if someone can send me an email really quickly on the side and let me know. I apologize for the technical problems. Just want to make sure everyone can hear me and that this is working properly. Is anyone from All Chicago still on the line?
Yes, I am still here.
Okay. Is this?
I can hear you okay, and I can see that there are 51 or 49 folks in here, but I believe they're all on listen only mode. But yeah, if somebody wouldn't mind confirming in the chat that you're able to hear us, that would be great.
Okay, I have a couple people emailing me that say they can hear us, so perfect. They must be able to hear us. I don't know what is wrong.
Sorry, y'all. I don't know what is happening with us.
I'm glad you can hear us. Thank you to everyone that's emailing me to let me know. I appreciate it. Okay. Sorry, is this Savannah from All Chicago?
Yes, this is Savannah.
Hey, Savannah. Okay. Thanks for helping me get started. I would say you can leave if you want to. It's been glitching a little bit.
I'm gonna hang out for like 5 or so more minutes just to double check, and then I'll hang around for a little while.
Yeah, and people are saying there's no access to like a chat box. So normally there's like a questions or a chat that people can use. I don't know why that's not working. If you can see, maybe fix that, but if not, we just might not be able to do questions on the webinar because I don't think people are able to unmute themselves either, from what I can see. If somebody that's an audience member wouldn't mind unmuting themselves and just speaking really quickly, that would be great if I can know if you are able to unmute yourselves. Yeah, maybe not, because I can't see the this time, Savannah. Yeah, okay. Okay, well, I'll see if you're able to help with that. If not, I'll just have to have questions emailed to me afterwards. But we'll go ahead and get started. So, hi everybody. Sorry again for some technical problems today. This is Justine Allenbach from the Center. This is our Skilled Assessor quarterly meeting, which is mandatory for skilled assessors, optional for skilled assessor supervisors, and also optional for housing system navigation. If this is your first skilled assessor quarterly meeting, this is kind of our chance to come together for me to provide some updates about what's happening related to the skilled assessor role and what's going on in coordinated entry. And so we'll go ahead and get started. Thanks. Some of you are also letting me know that you can't unmute yourselves, so I do apologize for that. If we don't get that figured out by the end of the webinar, I'll just have to have questions sent to me via email, so I apologize. So just to reiterate, my name is Justine Allenbach. I'll be presenting today. I use she, her pronouns, and I work for the Center for Housing and Health as the Coordinated Entry Specialist. Here's our quick agenda for today. I say short because there's not many items here, but each of these will take a little bit of time to cover. So I want to give an update about what's going on with the transitioning of our HMIS systems, or actually the not transitioning. So we'll talk about that for a moment. I also want to reiterate the 90-day inactivity policy that's going to be taking over as of October 1st. I also want to provide an update on the individual vulnerability index and then share a quick sort of training reminder of how we should be always doing interim updates and not giving people multiple CES entries. So I'll show you guys how to do that, how to do an interim update quickly. And then besides that, I was going to leave time for the end for questions, but I'll just wrap up the meeting maybe a little bit early so that you all can send me some emails, and I'll be available for the next hour afterwards too, really until the end of the day to take your calls and answer emails. So let's go ahead and get started. So the first thing I want to address is an update about the HMIS transition. So some of you may know this, some of you may not know this yet, but our continuum of care is not going to be transitioning HMIS systems. We are going to be sticking with the current HMIS vendor, which is WellSky. So our HMIS system, which is in a platform called Service Point, is going to be staying as is. New HMIS system, which you may have heard was going to be Clarity. We're no longer going with that system, and it's going to remain with Service Point and WellSky. So that is a big update. We have been sort of postponing a lot of things. A lot of things have been on pause because of the possible HMIS transition. So for example, we've paused allowing most new skilled assessors. We haven't been allowing that because we were concerned we were going to transition into a new system at any moment and the training would have been just completely off. But now we're open to adding new assessors, within reason, from various agencies. So there'll probably be new skilled assessors added to our continuum of care, more than there has been in the last few months, knowing that we're no longer going to be making this transition. Some other changes that are going to come from this are changes to the CES housing assessment. So there was going to be a good amount of changes to how we did coordinated entry housing assessments with the Clarity HMIS system. A lot of those housing assessment updates, I think, are still necessary, and we're just going to have to think about how we can create those changes within Service Point. So there's probably going to be a fairly important large training either at the end of this year or into the beginning of 2022 about changes to the coordinated entry housing assessment. We still have to make all of those changes now and figure out how they're going to be made in WellSky, but that's just a heads up that stuff like that is going to come. So we are going to update and refine, upgrade our coordinated entry housing assessment, which is probably going to involve a lot of simplification. So just so you know, that's something that's going to be coming up. It's been on hold while we've been in sort of this limbo area, but that is going to be something that is going to happen. So stay tuned. I also just realized I think the question box is answering or is working for me now. Thanks, Savannah, if you made that correction. We'll probably be able to do our questions then at the end. So thank you guys for letting me know. I appreciate it. So that's the update with WellSky. There's probably a lot of questions about that. I'm going to save questions for the end if you don't mind, so we can just get through all this other information. But I just wanted everyone to know that we're sticking with our current HMIS system. The next big announcement that I want everybody to be familiar with is the upcoming new coordinated entry 90-day inactivity policy. So as of October 1st, 2021, which is coming up in a few weeks here, the coordinated entry CES inactivity policy will be that everybody has to update their assessment every 90 days. So this is a change from what we've been doing. So historically, in order to remain active within coordinated entry, participants, if they were not enrolled in any additional projects in HMIS, they would have to update their assessment every 30 days. If someone was enrolled in an additional project in HMIS besides coordinated entry, then they didn't have to update their assessment at all unless something had changed. I think this was too complicated of a way to approach inactivity, and what we found was that every 30 days for some folks was really overwhelming and a little bit too much. And then on the flip side, never having to update your assessment unless something changed for you wasn't really working either, because things were changing for participants and we have struggled a lot within our system of not having the best updated contact information for participants. So it's now going to be 90 days universally for everybody. So I would encourage that you start talking to your clients about this now. So if you have folks that you work with that you're a skilled assessor for, please tell them about this inactivity policy. So everyone's going to need to start updating their assessment every 90 days. If somebody does not have an update to their assessment within that 90-day time frame, they'll be considered inactive and they would be ineligible to be matched to housing through coordinated entry. So this is really important. We have some amazing skilled assessors and housing navigators that have been proactively outreaching to folks that are close to approaching 90 days without an assessment or an update. And this has sort of been a way of trying to make it so that when we make this transition on October 1st, it's not so dramatic of a transition and we end up with a huge amount of inactive people. However, I can tell you from the numbers, there are a lot of people that are beyond 90 days without this. And so there are going to be a fair amount of people that are inactive once we reach October 1st. And so if you have participants that you know are still in need of housing through CES and you just have not heard from them for a while, or you think they haven't updated their assessment in a while, please try reaching out to some of those folks or just talking to the participants you serve in general about this policy, because it is going to be taking over October 1st. And we just want as many people to know about that proactively as possible. Okay. The next thing I wanted to share with you all, and this as well as the inactivity policy was shared in our skilled assessor newsletter, but we no longer need to be doing the individual vulnerability index VI. The individual VI is not being used to determine how individuals are prioritized for housing under the temporary prioritization. We are still using the family and youth vulnerability index for understanding how family and youth participants are prioritized for housing through CES. So those VIs should still be completed, but we do not have to do the individual vulnerability index right now because it's just not something that we're using to understand how individuals are prioritized under the temporary prioritization. So effective immediately and effective as of a while ago, you do not need to be doing this anymore. If you have questions about that or want to talk more in depth, just let me know. I'm happy to have a deeper conversation about that. But essentially, we're just not using it to understand how individuals are matched for housing. So we don't want to ask folks unnecessary questions if we're not using it for understanding who should be matched. So thank you for kind of your accommodation and flexibility with that. If anything were to change with this policy, I would definitely let you know, but it's just not something that we need to do right now. Okay. I did see one question just pop up. I'll answer most questions at the end, but I see one in here that just says, does the family vulnerability index still need to be completed? Yes, we're still completing the family and the youth vulnerability index. Please complete both of those if applicable, just not the individual VI. Thanks for that question. Okay. Moving on, I just wanted to share a quick reminder for assessments, something that I've been noticing a lot recently. If somebody already has a coordinated entry housing assessment completed, we don't want to add another project entry for that participant. We just want to update their assessment using an interim update. So what I mean by that is if you're working with a participant and you're going to have them assessed for coordinated entry and you notice that they already have a CES project entry in there, then you don't want to add a second coordinated entry project entry. We just want to update their information from whatever that entry already is. So let me show you guys just kind of what that looks like here. So this is a hypothetical client. This is not a real person, just somebody for training purposes. If you were working with this client named Lily, and you notice Lily has a coordinated entry, project entry here, which is what that looks like. And Lily said, well, I haven't updated that, or I don't even remember who I did that with. I think I need it to be updated. You would also know in this case that Lily should update it anyways because they're beyond 90 days. So especially as you're working with clients and you notice that they haven't been updating their assessment within 90 days, this is when we're really going to want to start doing this. So you would want to do an interim update with Lily and not just add another project entry. When people have multiple coordinated entry housing assessments, multiple entries, then we don't really, they just show up in the data systems and how we do matching in multiple ways. And sometimes that can be confusing and it can unfortunately kind of mess up how they get matched. So we just want to make sure they always have one thing. So we're always looking at the most up-to-date information and everyone's working off of that system and that coordinated entry assessment. So you would go to interim updates here, and I've highlighted where you would use the interim updates in this sort of notebook that I've circled here. So what you would do is you would click on this notebook, and then what it's going to do is open you up into an interim update. So it'll give you a sort of drop down menu here that you click, and it'll open up with all of these options. And you can just always do update. Some of these other things kind of apply, but we just like to say update, so you don't have to use any of these additional options. Just always use update. Make sure the additional household members are checked off. If someone was not in the household anymore, you could unclick them. If they're an individual, the additional household members wouldn't even apply. But just make sure everyone's checked off if they're still belonging to that household, and then you would just press save and continue. When you press save and continue, it's going to open you into the assessment, and it's going to look exactly the same way the original coordinated entry project entry would look like. It's not going to be any different. It's just going to look exactly the same. So that is the interim updates. Just kind of a reminder to please be updating folks' information via interim updates and not giving folks multiple coordinated entry housing assessment project entries. Okay, so that's all I had. The updates themselves that I had for you guys is pretty short to explain, but I realize there might be a lot of questions for some of those items. So I'm just going to pause, and if you are, I think you should be able to unmute yourselves now. Let me just make sure that's accessible. Okay, I think you can unmute yourselves. One second. Okay, you should be able to if you'd like to. Otherwise, please keep yourself if you don't have a question, just for noise interference, and I'll also be checking the question box.
Hi, Justine. This is Tanzella. How are you?
Hey, Bella, I'm good. How are you?
I'm great. I still have the question. What happens when an individual has been matched, but yet they are not qualified to be in that particular segment? You know, they say that they will be rematched. I've had people to call me and they have been waiting for at least a year or better to be rematched and to come back into the CES system through one of us, and still nothing happens. You follow what I'm saying?
Yeah, yeah, definitely. There are, unfortunately, this happens a lot, or it's a frequent occurrence that people are matched to housing through coordinated entry and they're not actually eligible for that program that they were matched to, which is sometimes figured out by some reasons that happens is somebody reports certain things when they have the coordinated entry housing assessment completed. And then when it comes to documenting that or proving some things, it doesn't end up being that the participant had the documentation or just the eligibility for some of those programs. So sometimes that's the reason that happens. It can also just be that participant wasn't found in sort of that usual 2-week time frame since a housing provider receives the match or the referral, and then they have 2 weeks that they should be attempting to engage and reach out to that participant. And if participant is not contactable, then they would be rematched. And unfortunately, sometimes then the participant shows up days later and is saying, you know, I'm here, and then they're rematched, and it can take some time for that rematch to be made. So this does happen. It's kind of a larger issue in the system. One thing I can say, Tanzella, that you could do is if you're working with participants that are just sitting in this sort of limbo area, sitting in sort of rematch land, and we're just wondering what's going on with them having a new match made, if you would like to email myself, I can reach out to the matching team to just get an update on what's going on with that. Something that might be changing, so we kind of are going to have some new leadership with coordinated entry overall. Some of you might have been familiar with Stephanie Seidman, who was the longtime program manager at the Corporation for Supportive Housing, the program manager for coordinated entry. Stephanie has moved on to another role at the Corporation for Supportive Housing, CSH, and the new program manager for coordinated entry at CSH is Jonna Lowe. And Jonna Lowe and CSH are co-lead for coordinated entry along with the Center for Housing and Health, which is what I work for. And so there's been some conversations with sort of Jonna and myself sort of becoming these co-leads for coordinated entry, talking about just some more transparency and different ways of doing matching. We've been kind of trying matching in a SIT form, so system integration team meetings matching instead of just sort of the email system. And that's been helping a bit. But we might end up creating a system integration team meeting for rematches specifically, so we can come together with some providers in the community and skilled assessors and talk about folks that are sort of just sitting in rematch. In the interim, until we have that established, Tanzella and anyone is welcome to email me and say, here's this person's case, this is their HMIS ID number, they were rematched this time long ago, can you give me an update on where they stand? And I can reach out to our matching team, get an update on what's going on with that, and then provide you with an answer. Unfortunately, if somebody was rematched because they're ineligible for permanent supportive housing, then it's not that they would be rematched to another permanent supportive housing program. They could be rematched to something else. And it's not always that in those cases where someone is actually not eligible, they're just rematched right away. They might be placed back on the wait list until they're matched in the fairest way for something that they're actually eligible for. So it's not always an immediate thing. Sometimes it is, sometimes it's not, but you can reach out to me and we can at least get an update on what's going on for those participants. So I hope that helps to answer your question in some ways, but I do recognize it's a problem and people sit in that rematch land oftentimes for too long. So thank you for bringing that to my attention.
Okay, thank you.
Thank you.
Hi, Justine. My name is Giselle Lewis.
Hi, Giselle.
Hi, I have a question. Someone brought it to my attention that all Chicago was paying up to 6 months worth of rent for people who were in need. I just wanted a little bit of information on that.
So I have not heard of that or heard of that program. If you wanted to connect with me offline, maybe about like where you heard that from, or if you could like forward me some information, I could try
Okay.
and connect you with somebody that could give you more information from All Chicago. I don't work for All Chicago. I'm at the Center for Housing and Health, but I do work a lot with folks from All Chicago, so I could try to find somebody to connect you with. It might be coming from some sort of program or grant with the Department for Family and Support Services, DFSS, which is the city. And sometimes DFSS has things called emergency funds where they pay, sometimes they'll pay rent for a short amount of time or an emergency bill or something for people that are facing imminent homelessness or people that might just need a security deposit, things like that. So it might have something to do with those emergency funds from DFSS, but it could also be something separately. So if you just want to shoot me an email separate, we can figure out what the program is. I just would probably need a little more information.
Okay, I sure can. I'll do that. Thank you so much.
Thank you. Welcome to your first quarterly meeting.
Thank you.
You're welcome.
Hi, Justine.
Hi.
Hey, this is Andrew from over at Harbor Light.
Hi,
Hey,
thank
I had a quick question about the 90-day inactivity.
Yeah,
So the majority of the clientele that we work with, they're transients. So we're encountering them at encampments or on the streets in general. After they go 90 days inactive, is there a closeout date? And then if we were to encounter them after that 90-day period, should we do another entry at that time, or will interim update still work in that situation?
that's a great question. The interim update is supposed to just work again to re-enter them into the system. So don't do another entry, do an interim update, and that'll just bring them back in. So they would be sitting at, I mean, once somebody is past 90 days, they're just automatically going to become inactive. There's not really much leeway to that as we get to October 1st. But if you see somebody and they haven't had an assessment done for, let's say, 100 days, like they just went past it by like 10 days over, and they're inactive, if you did their interim update that day, it'll bring them back into being active. Just during that inactivity time, so that 10 days they sat inactive, during those 10 days they wouldn't have been considered eligible for CES. But if they get themselves updated, they'll be re-entered into the system. They'll become eligible again. So, and yes, please do that using an interim update and not a new project entry.
So, Justine,
Thank
this
you.
is Pat. I'm sorry. Go ahead.
Oh no, I was just saying thank you.
Oh, okay. This is Tan again. So my question in regards to piggyback right off of what he said, what if their particular CES assessment has been closed? We can't necessarily do, if they've closed it out,
Yeah,
we have to do a new assessment, even though all of the information is still in the system. We will have to reopen it into another CES interim, correct?
yes. That's a
Okay.
good point, Tan. I think there would be some amount of time. I actually don't know how long it would be before they were actually like their coordinated entry assessment was exited. So if there's an end date, that means it's no longer an active coordinated entry assessment. I think if someone becomes inactive, that doesn't necessarily mean they're going to have an end date in there. I think it would probably be another 90 days before someone's project was actually ended. It would just mean that entry was inactive, but not actually closed out. If you encounter somebody that is closed out of that coordinated entry project, it has an end date, then yes, you should do a new one and not do an interim update. Please do like a whole new coordinated entry assessment. I still think though it'll pull in information from the other one. So even if you do a new one, I think it still pulls in information from that other assessment so that you're not necessarily having to fill out everything from scratch. But
Right.
in that case, yes, please do a brand new project entry and not an interim update in those situations that it has an end date.
Okay, great. Thank you so much.
Thank you.
Hi, Justine. This is Doreen from Casa Central La Posada. So I want to get clarification. The only time that we would put an end date for a CES would be if the participant obtained housing, like their own apartment, and not if they went to live with a family member.
That's correct. This is probably going to change soon, but as of right now and for historically, we have never wanted skilled assessors to end someone's coordinated entry assessment, so never do a project exit and put an end date. And I'm going to stick with that for right now. So even if you encounter somebody that is housed, I don't think we're supposed to be as skilled assessors being the ones ending those. However, I think that's going to change because sometimes we're the only ones that do know if somebody is actually housed now. So I think All Chicago is who's managed the exiting of folks from coordinated entry, but I think the exiting system hasn't been working that well recently. And so something that I've recently brought up to them is sort of changing our ideas of who can end and exit people from coordinated entry. So you all as skilled assessors, that might be something we start asking you to do. But for right now, please don't worry about it and don't exit anybody. But yes, Doreen, if somebody was housed, that would be an example of when they're actually exited from coordinated entry. There's some other little examples, but right now it's not something we're having skilled assessors do. And if that changes, I will let everybody know, and I will make sure everyone knows what's appropriate for exiting from CES.
Okay, thank you.
Thank you.
Hi,
Hey,
Justine. This is Maria.
Hi, Maria.
So for clarification, if we see any duplicates, you want us to do interim updates on the most recent completed assessment, correct?
Yes, please. If you see that someone does have duplicates, then please just make an update to whichever is the most recent, which is also like whichever has the most recent interim update too. So some of them might have, so if someone has two coordinated entry project entries, one might be the more recent entry, but the other one might have a more recent interim update. So whichever one has like the most recent point of contact, please do the update to that one. And then if you could let me know, so I'm kind of trying to clean that stuff up a bit. And if people have multiple CES entries, I'll usually myself delete the one that seems kind of more outdated. So if you could let me know when you see that, I would appreciate it because I can probably delete whichever extra coordinated entry assessment or assessments are there so that we can make sure that person just has the one solid CES project entry. But yes, please just update whichever's most recent. And then if you have the capacity to shoot me an email and let me know about someone having multiple entries, I'll take care of that as well.
Is there a way that it can be better streamlined? Because I'm pretty good about checking for duplicates,
Yeah,
but sometimes they don't show up.
yeah, that they don't, the multiple entries don't show up.
Yeah. So can that be looked at?
Yeah, I think sometimes they might not be showing up because of a visibility issue. I'll bring that up to All Chicago. And I also we might change policies around this where skilled assessors could also delete a duplicate entry. If you all see like this one's outdated, I've updated their more recent one, then you all would be able to just delete the old one. So that might be something that's going to come as well. But I'll let All Chicago know about you not seeing the multiple entries and see if I can get an answer as to why that's happening.
So,
Okay.
so Justine, in the event, once that does happen to where the skilled assessors will be able to delete duplicates, we would really have to go in and assess each one of them to see which is the oldest and which is the newest, correct? We couldn't just, do it by, face value as far as the date. Would that be correct, or?
I might have to give some more thought to that. My first thought is you would be able to just do it based on whichever one has the most recent date, but you are right, Tan, in that it should also be possibly considered whichever one has the best information, like what's the best quality assessment that they have. Um, so I'll give that some thought. I usually don't want skilled assessors to have that much responsibility. We want assessors to be doing assessments and be doing them well, but we don't necessarily want assessors to worry hugely about data quality or cleaning up data quality in HMIS. So I don't know if we'll ever be having you all do that. It's just something I've been kind of thinking about, and I'm open to feedback. I might send out like a poll or a survey to you all about if that's something you think you have capacity to deal with on top of your role as an assessor already. So don't worry about it right now. Just stay tuned. And if we decide that assessors can do that, I'll let you know how that decision should be made. And it probably would involve making sure that you're not deleting like the best quality assessment, like you mentioned. Thanks for
Right.
bringing it up.
Now I have one more question, if I may. At one point back last year, you were stating that you wanted to let us know how they go about matching people, as far as, housing goes. I know at one point when we first started this program that we stated that, this is for chronically homeless as well as disability. However, it has not, I get people, and I'm sure we all get people who are homeless but not homeless and are trying to be on our listing. As I tell them, this is a project that is for chronically homeless as well as disability. Are we still on that same page? Is there somewhere we can address and give these other people, direction to, um, what's the best word? To say this is where you need to call to get whatever assessments that you need for help.
Yeah, so in terms of what's being looked at and how to determine if someone, is being matched to housing or what the matching team is looking for, the matching team is looking at the information from the assessments and using that in combination with the prioritization. So the prioritization for CES, we always have a prioritization that's functioning. Our current prioritization prioritizes people that are at a high risk for severe outcome to COVID-19. I always include the prioritization in our skilled assessor newsletters. For folks that are a newer skilled assessor, this is, kind of new information. So I apologize if this is something you're super familiar with already, but the prioritization is how we prioritize who receives the housing resources that CES refers to. That there's not enough housing resources in our continuum of care for everybody that's been assessed to receive housing. If there was, we wouldn't have to have something like the prioritization, but there's not, unfortunately. So we do determine as a community how we prioritize people that have had the CES assessment completed. The entity that decides the prioritization is the coordinated entry leadership team. So I am recently a part of the coordinated entry leadership team, but I wasn't for a long time. I used to, just be on our implementation team. The coordinated entry leadership team is made up of a variety of housing providers. that have stakes in the continuum of care, and they make kind of that final call, but there's also sub work groups that go into the prioritizations that get even further community feedback. And those are definitely tough decisions to be made. So the housing or the matching team is using that. And so something that's important right now, like the first thing that people need to have to be matched to housing through CES right now is they need to be high risk for COVID-19. There's some exceptions to that, and the prioritization document that I include in the newsletter mentions some set-asides. So 10% of all of the housing matches through CES being made are for families, and another 10% I think are for youth, and there's another 10% for people that are sleeping unsheltered. And so those are set-asides that we're always matching to, and people don't have to be high risk for those kind of set-aside matches. We want some space always saved for those special populations, folks that are unsheltered, families, and youth. Besides that, though, we're using the prioritization, which is anybody that's at a high risk for a severe outcome to COVID-19, and also is enrolled in additional projects besides coordinated entry. The additional projects piece was determined because we wanted to find people that were most likely to be contacted, and the leadership team had decided that people that are most likely to be contacted have multiple entries in CES besides, or multiple entries in HMIS, sorry, besides just coordinated entry. So that's where that thought was, and I think that was also kind of decided amongst the urgency of the pandemic. We wanted to prioritize folks that we knew we could get in contact with. So besides that high risk piece, the way that the assessments are being used to determine housing matches are, all of the elements of it. So in particular, we think about the questions that ask if there's any sides of the city that folks wouldn't live on. If people have very hard lines of areas they wouldn't live, then the matching team is not going to match someone that says they won't live on the north side into a housing program that's on the north side of the city. So they're using that element of the assessment.
Right.
Determining chronicity is used in the current living situation and length of homelessness, and then the disability information we collect in the VI and disability section. So no one's going to be matched to PSH if they're not chronically homeless. PSH, permanent supportive housing, sort of our highest level of subsidy that has no time limit, is only going to people that meet the prioritization and are also chronically homeless. So that's another way the assessment is largely used. I can say that everything in the assessment right now, with a few small exceptions, the matching team looks at and matters. If something doesn't matter anymore, that's, I let you guys know. That kind of comes into why we're saying we're not using the VI anymore. We're not using it, so we don't want to ask folks unnecessary questions.
Right.
And I think some other things we could simplify in the assessment. I've been having more conversations with the matching team recently about, or the matching team's leadership. So like the program manager for the matching team is Loren Webb at Catholic Charities, and I've been working more with her about figuring out what they really need so that we don't ask folks things we don't have to. So like I said, with some changes to the assessment, that's definitely going to happen. It might happen this year, and it might happen kind of at the beginning of next year, but it is to come. So everything in there right now, the matching team is using, though, and especially having the assessment done really helps us determine the best match to make for somebody, and also measures chronicity, which is very important. So I hope that kind of answered your question. I'm sorry if I didn't specifically touch on something. Was that helpful?
It was. Thank you.
Okay, thank you.
Justine, I have one more question. This is Giselle from Life is Work.
Hi, Giselle.
I want to know, during the interim update on the summary, their original project start date is the date that's supposed to be showing, not the update, correct?
Say that again. The date that's showing in like the summary is just the original start date. Yes, that's correct.
First incident. Okay.
Yeah, that's whenever their very first project entry happened, but it's not like what's most recent. They might have a more recent update in that interim update section.
Okay, thank you for that.
If I may, this is Tan again, I'm sorry.
That's okay.
Piggybacking off of what she just asked, from the first assessment that was done, does that individual have to continually do an update interim on that particular date each month? Does it, if it won't go against them if they call earlier or call later? Will it, as long as they call within that 30 days?
Correct. So as long as they call within that 90 days, that's fine. So, you know,
Okay.
if somebody was like, if they had their assessment done yesterday and they called and updated their assessment in 2 months, which would be earlier than they have to, that's great. You know, maybe they have something that updated. If someone's phone number changes the day after they had their assessment done, we still want them to call. So I should say it should be every 90 days at least. But if something changes for them, we also still want to know that. So if they want to call earlier, that's great and that's totally fine. And then the 90-day requirement just starts over from there. So then it would be another 90 days that we would at least have to get some kind of update from them.
Right.
And it's okay too if they call and just say, hi, I just need to update my assessment. Nothing has changed. Phone number's the same. I'm staying in the same place. Then all the skilled assessor has to do is really create the entry and then press save and exit. But normally within a 90-day time frame, usually something will have changed for them. So kind of where they're hanging out might have changed. They might be staying in a new location. They might have a new phone number, a new email address, etc. So we usually find there's something to update every 90 days, but if there's truly not, that's okay too. But yes, it's okay to call in early, of course.
Okay, great. Thank you.
Thank you. Great questions. Really
I
good.
missed one more time. I'm sorry if I cut anyone off. I have a client who, speaking of a little bit off what she said, I have a client who said that she never, that she actually called in and did an update with someone, with and with an assessor.
Mhm.
But there's an exit date here, and she said that she never spoke to someone about an exit date. She never knew that she had been exited. So what do I do about that?
Mhm. Okay. What I would do is I would just do a new assessment with them. Um, you would just do a new assessment. I don't know why they would have been exited. Um, that's odd. If do you want to send me their HMIS ID number, Giselle, and I'll just take a look at it. But what I would probably say is we just need to have them either through you or through the call center have a new assessment completed since their old one has an exit date.
Okay, I will send her I will send you her information.
Okay.
Hey, Justine, who does the exiting? Is it the housing piece, the matching team who will exit someone out? Who does that?
It's supposed to be all Chicago. There was supposed to be like an auto exiting system where if someone's HMIS profile ever had information on it that client was deceased or had a project entry for a housing program, then they were supposed to just be automatically exited from CES. But I've noticed for a while that that's not happening. And so how I mentioned a little bit ago, I was having a conversation with All Chicago about that. I've been speaking with their HMIS team about the auto exits, and they're looking into what's going on with that. So I feel like I'm not on the same page with HMIS right now about who is exiting people from CES. We definitely want folks exited if they're no longer in need of coordinated entry. So it's something that's being worked on, but it was supposed to be an auto exiting system. But I just think there's been a lot of things broken in HMIS for some time that it's supposed to be resolved in the near future with WellSky. I know All Chicago had a lot of conversations with things that needed to be fixed if we were going to stay with this HMIS system. So I imagine that's one of the many things that should be worked out.
And has that been determined that we are staying with the present system that we're in, or are they still looking into changing it?
We're gonna stay with our current HMIS system. So that vendor is WellSky, and like the platform is called Service Point. So when we log into HMIS, that's kind of why it says Service Point. And the vendor for Service Point is called WellSky, but we're sticking with that. We're not going to change systems anymore. So WellSky is just working with All Chicago to address the problems that our community has felt that we had with Service Point, and so I'm hoping that a lot of those things will be addressed, but we are staying with that. We're staying with Service Point and WellSky.
Okay, great. Thank you.
Thank you.
Justine, this is Ali.
Kelly.
I had a question. So if I go into HMIS and I input somebody's name and their profile comes up, but there's been no information, no release of information, no assessment or anything done. It's just their name. What does that mean?
It's just totally blank.
Yes.
If someone has a totally blank profile and the only thing in there is their name, I think the only explanation for why that happens is they might have been engaging with services with someone, with some kind of homeless provider in the COC, and for whatever reason, either the client stopped working with them, something like they ran out of time, they didn't complete whatever they were going to complete in HMIS for them. So normally no one's just entering people into HMIS without then entering them into some kind of project. So coordinated entry, for example, is one project in HMIS that skilled assessors enter people into. But there's a lot of other projects in HMIS as well, and there's a lot of specific projects for specific agencies and housing programs and drop-in centers and shelters, etc. So if someone's completely blank, it's either that they just kind of stopped and didn't finish whatever someone was working on with a client. Another reason people can appear blank, though, is you might not have the visibility to see what they're entered into. So some programs have higher visibility controls than others, and so some programs, if they enter somebody into HMIS, we're not able to see that program entry unless you had that project's like access level. So that's also why sometimes things can look blank. But that's kind of the only two reasons I would say that happens.
Okay, so if it's for any reason, do we just, when we encounter a situation like that, do we just go ahead and do an assessment? Because if it's the second
Yeah.
thing you mentioned, then how are we to be sure if we're doing a duplicate assessment?
Right. You should, if something is blank, because you have coordinated entry access. So if you're in that coordinated entry mode and you see that someone's entry exit tab is blank, there's no coordinated entry assessment or project entry in there, then that means that person has not had an assessment done at all, and you can do an assessment with them.
Okay. And go ahead. You was gonna say something else?
I was not.
Okay. And my last question is, considering we're not moving to clarity, does that change the idea or the plan to get rid of assessors, supervisors?
Yes. So the decision to not move forward with clarity is definitely a big shift in thinking from kind of the direction things were going. There's been a lot of changes recently. That's a big change. I also wanted to announce, if folks weren't aware, so my supervisor, Ben Darby, is leaving the Center for Housing and Health. So that's another kind of big person in coordinated entry that's stepping out. So John Alo is sort of taking over the new program manager replacing Ben will be determined at some point in hopefully the near future. And once that's figured out, I'll definitely let everybody know. But we're kind of starting from fresh in a lot of ways, and I am kind of evaluating where we're at with skilled assessors. We're not reducing the number of assessors anymore as we were at one point. And we're not eliminating, supervisors' involvement either. So there are changes to come. And I think that probably what that's going to look like is in a few months from now, I will just be reaching out to people, asking them how assessments have been going for them, if they still need their access, etc. And then I'll just need an update from everybody on who their direct supervisor is, because I think I have some pretty outdated supervisors listed for people too. But we're not making that reducing of assessors anymore. That's not happening. That was supposed to happen with Clarity, and since we're not doing that, it's not going to happen either. So some stuff is just going to be different in general, and I know things have been a little bit unpredictable, and I just really appreciate everybody's flexibility with these changes and everyone's flexibility with the HMIS system. And right now, everyone's skilled assessor access is staying. We're not making any changes for at least a few months. We're just sort of adjusting to this news of staying with our current HMIS system, and things will just have to go from there. But thanks for bringing that up, Ollie.
No problem. And I did have one other question.
Sure.
The call center where
Yeah.
we're being told to direct, homeless youth, is that still how we're going to proceed, or are we doing assessments for youth ourselves?
So you can do assessments for youth yourself. You can direct them to the call center too. I think it's possible you might be confusing, but we usually prefer that unstably housed youth are diverted to our Catholic Charities Youth Diversion Coordinator before we do an assessment with unstably housed youth. So unstably housed is not literally homeless, but youth that are facing housing instability or are at like imminent risk for homelessness. We usually like to refer them to Diamond Bruseb, our youth diversion coordinator at Catholic Charities. And Diamond will just kind of navigate with them their options because that addresses more of the immediate crisis need they're facing versus having the assessment done, which doesn't just address what they're immediately facing. Because we might be able to do things such as mitigate with family members and things that could help them more immediately than just doing the assessment. So I've shared Diamond's information in the past, but I'll share Diamond's information again when I send a follow-up email for this webinar so that folks have that information and can be using that as well.
All right, thanks a lot. That's all I had. Thanks for correcting me.
Yeah, thank you. I know we're a little bit over time, so I'm just going to wrap this up. If folks have more questions, please feel welcome to send me an email offline or give me a call. I'm going to send a follow-up email with some of the information we covered in our questions section today. I appreciate you guys being here. I appreciate your flexibility. I hope that everyone is safe and doing well. Let me know if you have anything that you need to talk about. I'm here for you, and thank you for being here. I hope you all have a good rest of your day.
Thank you.
You as well.
Thank
Thank you.
you.
Thanks,
Thanks,
everyone.
Jesse. Appreciate it.
Bye-bye.
Bye.